Hi, I'm Sherry Saxonhouse. I'm one of the electrophysiologists with Sanger Heart and Vascular Institute, Atrium Health.
And I'm Alice Moran, one of the nurse practitioners of Sanger Heart and Vascular Institute Electrophysiology of Atrium Health. Dr. Saxonhouse and I today will be discussing what atrial fibrillation ablation. We'll discuss what the procedure entails, some of the pre-procedure and post-procedure things to expect.
Atrial fibrillation is the most common arrhythmia in the United States. It affects many people, leading to symptoms of shortness of breath, chest discomfort, fatigue, palpitations, and skipped heartbeats. Until recently, first-line therapy for atrial fibrillation has been medications, particularly antiarrhythmic medical therapy. Antiarrhythmic medical therapy is not well tolerated by patients. Patients have to take them indefinitely, and they have symptoms associated with them. Atrial fibrillation ablation is a procedure that has recently, through clinical trials, been shown to be extremely effective in eliminating and decreasing episodes of atrial fibrillation. We now know that atrial fibrillation ablation decreases episodes of atrial fibrillation, decreases hospitalizations in patients who have congestive heart failure, and patients do significantly better and improves their quality of life. There are 3 types of ablations that we perform under the category of atrial fibrillation. They have one common goal, and that goal is to eliminate the abnormal electrical signals that start and maintain atrial fibrillation. The most common type is radiofrequency ablation. Radiofrequency uses a catheter that heats and eliminates the abnormal tissue. The second type is cryoablation. It's actually a balloon that freezes the tissue and eliminates those abnormal signals. The third type of ablation is a hybrid AF ablation that combines catheter-based ablation with a minimally invasive surgical procedure. This is particularly good for patients who have had long periods of atrial fibrillation. These procedures take 2 to 4 hours. Depending on the complexity of the procedure, they can take even longer. You will be asleep for the procedure under general anesthesia. There are rare complications associated with the procedure, which include stroke, damage to adjacent structures in the heart, and bleeding. It is generally a safe procedure, and most patients are able to go home the same day.
Either the physician or nurse practitioner or physician assistant will be seeing you. We'll be scheduling the procedure with the nurse navigator. The nurse navigator is one of the key players in having the AFib ablation scheduled and in your care pre, post, and during the procedure. The nurse navigator will be setting up your CAT scan. The CAT scan will be done to look at your anatomy as well as to check for a blood clot in the heart, which is important for us to know prior to an ablation. Prior to the ablation, we will also get blood work. We will also make sure you're taking your anticoagulation, whether you're taking Xarelto, Eliquis, Pradaxa, or Coumadin. We want to make sure you're taking it uninterrupted at least 30 days prior to the procedure, and then you'll be taking it uninterrupted for 3 months post-procedure. So if you have any other procedure or surgery you're thinking of scheduling, do not schedule it until at least 4 months post-procedure. What to expect after the procedure? You will be going home that day, most likely. There'll be 2 medications you're going to be put on that will be different than pre-procedure for a very short-term period of time, one for 2 weeks, one for 4 weeks, and they're called Prilosec or omeprazole. The other one is Carafate. And these medications are to help protect the esophagus post-procedure. You also will be needing to not lift greater than 10 pounds for 2 weeks. So if you do a job with any type of manual labor, you want to wait at least 2 weeks until you go back to work. If you have a desk job and are just working at a computer, you could go back to work in a couple of days. As far as exercise, you can walk, you can do things around the house, but when it comes to going to the gym with any heavy lifting or running or cycling, you want to wait for 2 weeks post-procedure. As far as your care post-procedure, one of us, and one of the nurse practitioners or physician assistants, will be seeing you a week after the procedure. And at that point, we'll be going over how you're feeling, if your groin sites, how they're looking. Do expect to have some bruising after the procedure because you have been on a blood thinner, as you know, prior to the procedure. This is also a time we talk about post-procedure. It's not unusual to have some recurrent atrial fib right after the procedure up until a few months after due to the inflammation and scar tissue. This is not to be unexpected, so don't be surprised. This risk of having recurrent AFib does go away within a couple months after the procedure, so just don't be surprised if you do have AFib right after. As far as follow-up with the physician, you will be following up with your electrophysiologist within about 3 to 4 months post-procedure. The nurse navigator, which will be the nurse that is orchestrating your scheduling your procedure, will also be keeping up with you within the period of time before the procedure and up to 30 days after the procedure.
Atrial fibrillation is a condition that now has therapy beyond medications. As you heard today, we have a comprehensive care team here that looks forward to taking care of you throughout this process. This includes highly specialized nurses that are specialists in the hospital for the procedure. It includes our nurse navigators and nurse coordinators in the office, as well as our physician assistant and nurse practitioners and the electrophysiologist. We're honored to take care of you. Thank you.